morning. Good morning, everyone. We'd like to ask that you please take your seats as we'll be started soon. Good morning, colleagues. We'll be starting soon, so we kindly ask you to please take your seats. Thank you.
Mama, I love you. You hold me, you keep me safe, you are my world. Not every baby gets this chance.
Every 7 seconds, a mother or baby is lost to causes we could prevent. Not enough midwives, not enough medicine, not enough time. But this can change when we invest in science, in strong health systems, in equality, when we make the choice to support mothers and babies, when birthdays are moments of hope, not loss. We protect the future. Because every healthy beginning means a hope for us.
Mama, I love you.
Esteemed representatives of the Philippine government, Your Excellencies, ambassadors, and distinguished representatives of the diplomatic corps, esteemed partners and colleagues, good morning and happy World Health Day. Welcome to the WHO Regional Office for the Western Pacific. This is the regional hub from which WHO supports 27 countries and areas that are home to more than 1/4 of the world's population. From the Mongolian steppes in the north, east to the Pitcairn Islands in the Pacific Ocean, and south to New Zealand. The region includes the world's biggest and smallest countries with a range of economic development, some with rapidly growing populations and others that are aging. It is a region of extraordinary diversity and extraordinary opportunity. I'm Annie Chu. I serve as a coordinator for health policy and service design here at the WHO Regional Office. It is my honor for me to be your moderator today. Every year on April 7, World Health Day marks the founding of WHO. More importantly, it's a moment to come together to highlight and reflect on a pressing issue affecting people all over the world, and especially in this region. This year's theme, Healthy Beginnings, Hopeful Futures, shines a spotlight on maternal and newborn health. It's a call to action to do more to ensure that every woman and every baby, regardless of who they are or where they live, receives the quality care they need and deserve, not just to survive, but to thrive. Every year, nearly 300,000 women die from pregnancy or childbirth globally. Over 2 million babies die in their first month of life. Sadly, 2 million more are stillborn. That's roughly 1 preventable death every 7 seconds, the same amount of time it's taken to finish this sentence. A staggering 4 out of 5 countries are off track to meet targets for improving maternal survival by 2030. And while progress certainly has been made here in the Western Pacific region, our job is far from done. Many women still face challenges, not just in accessing health services, but in receiving quality care that supports both their physical and emotional well-being. So whether you're someone who has the power to direct and advocate for health investments, support training and supplies for health workers, shape the laws and systems that protect women's health and rights, or simply listen to and support a mother in your life, you have a role to play. We all do. Excellencies, ladies and gentlemen, in front of you is a blue card. This is your invitation to commit, to make a personal pledge that supports women and newborns to have a healthier beginning and a more hopeful future. Over the next hour or so, we'll hear from a range of our esteemed and inspiring voices across the region. We'll encourage you to reflect and to write down your commitment alongside a photo of yourself. And later in the program, we'll bring these together in a visual display of our collective commitment, our collective action. And now it is my great pleasure and privilege to invite our Regional Director for the Western Pacific, Dr. Saya Mau Piukala, to the podium for his World Health Day address.
Honorable Dr. Teodoro Hebosa, the Secretary of Health of the Philippines, Excellencies, members of the Diplomatic Corps, fellow United Nations representatives, distinguished partners and participants, members of the press, ladies and gentlemen. Magandang umaga and good morning. Mabuhay and welcome to the annual celebration of World Health Day. It is an honor to speak with you on an issue that is vital to the future of our region, the health of mothers and their babies. This year's theme, Healthy Beginnings, Hopeful Futures, marks the start of a year-long campaign to improve maternal and newborn health. We urge countries and partners to renew commitments to ensure high-quality healthcare for every mother and every newborn. The health of mothers and babies is a crucial part of our drive to achieve universal health coverage. WHO works closely with government to support mothers and babies by developing and implementing evidence-based policies, strategies, guidelines, and clinical protocols. Our initiative aims to ensure integrated, people-centered maternal and newborn care. Our collaborative efforts are making a difference. The maternal mortality ratio, which measures mothers' health and the effectiveness of healthcare systems, has shown significant improvement. In 2010, 49 mothers in the region died per 100,000 babies born. Newly released figures show that this number fell to 35 deaths per 100,000 live births by 2023. While this is good progress, it is not enough, because even one preventable death is one too many. We are working hard with countries to save every life possible. Despite 98% of births being attended by skilled health professionals in 2023, some countries and areas still face significant challenges in providing basic care. Limited access to skilled birth attendants and essential facilities in these areas require urgent support to build maternal health infrastructure for maternal health services. Prematurity, birth complications, and neonatal infections continue to claim too many young lives, highlighting the importance of equitable access, the importance of high-quality care during baby's first month of life. Another threat to maternal and newborn health is the resurgence of vaccine-preventable diseases, especially measles. Measles cases in the Western Pacific have more than doubled compared to the same period last year, with outbreaks reported from Cambodia, the Lao People's Democratic Republic, Mongolia, and ongoing transmission in Malaysia, the Philippines, and Vietnam. The rising number of cases also increases the risk of international spread. Unvaccinated newborns and pregnant women are among the most vulnerable to severe complications. Ensuring high immunization coverage is about disease control and protecting the most at-risk populations. Strengthening routine immunization programs alongside maternal health care will be critical to safeguarding the lives of both mothers and babies. Most maternal deaths are preventable, caused by hemorrhage, hypertensive disorders, and other indirect obstetric causes. We need to reach every mother with quality, people-centered care throughout pregnancy and childbirth. This approach will also improve survival rates and well-being of newborns. The region has taken decisive action to improve maternal and neonatal health. With WHO support, member states have strengthened the health workforce, empowered women to play a more active role in their health, and enhanced data systems for regular monitoring. The region endorsed the Action Plan for Healthy Newborn Infants in the Western Pacific region 2014-2020, which introduced early essential newborn care to prevent avoidable deaths and give every newborn a healthy start. This approach focuses on strengthening health systems and creating supportive environments where care providers consistently apply essential practices at every birth. This simple, highlight, and this highly cost-effective solution has been a game changer. Over the past decade, early essential newborn care has saved lives in 9 priority countries where 95% of newborn deaths occurred in the region. The practice has been implemented in 6,500 childbirth facilities, where more than 42,000 healthcare providers have received coaching. Today, 93% of full-term babies in the region experience the life-saving face embrace, skin-to-skin contact with their mothers immediately after birth. Our work does not stop here. WHO remains committed to enhancing access to high-quality, respectful services across the pregnancy, childbirth, postnatal care continuum. WHO strengthened routine quality improvement mechanism by working alongside national counterparts, health authorities, professional societies, healthcare providers, and patients. These efforts are complemented by on-the-job coaching on how to prevent and manage the main causes of maternal mortality. As we move forward, let us reaffirm our commitment to ensuring that every mother and every newborn baby receive high-quality care. Health authorities can support improvements with sustained investments and create enabling environments for health workers to deliver quality care. By ensuring uninterrupted access to water and sanitation, and ensuring well-stocked facilities with essential medicines and supplies. Ladies and gentlemen, today we are facing a complex geopolitical situation that is evolving quickly, causing tremendous upheaval across sectors and forcing difficult decisions and reprioritization. I am deeply concerned about the impact of significant cuts to programs such as immunization and efforts to combat HIV/AIDS, tuberculosis, malaria, and polio. At WHO, we are on the front lines fighting for those who deserve a bigger voice. Our work is more vital than ever. Commitment to public health is critical. Health is one of the best investments we can make for ourselves and for future generations. By strengthening healthcare systems, funding research and innovation, and ensuring access to essential services, we improve individual well-being, economic growth, resilience, and social stability. We appreciate your solidarity here today, standing with mothers to celebrate their journeys in bringing forth new life. Providing maternal and newborn health is like weaving a mat. Health authorities, doctors, midwives and nurses, families and communities represent strands that must be carefully woven to create a strong, supportive foundation. Just as a quality mat provides comfort and security, quality maternal care ensures that every woman experiences a safe and positive pregnancy, childbirth, and postnatal period. We must focus on improving care, strengthening trust in healthcare systems, and ensuring that every strand of support is tightly woven together. Together, we can weave a healthy beginning and a hopeful future for every mother and every baby born in the Western Pacific region. I thank you.
Thank you, Dr. Piokala, for framing the challenges and aspirations before us. Your words remind us that maternal and newborn health is not only about the statistics, policies, and systems, it is deeply human. It's about the love, the care, and the moments that begin with a mother's first embrace of her child. And to bring that emotion to life, we now invite you to enjoy a special musical performance by our very own WHO Wipro Music Company. The song you're about to hear, The First Embrace, is a tribute to the universal bond between parent and child. It reminds us why the work to improve maternal and newborn health is so profoundly important. Please enjoy.
Miracle
Thank you, WHO Wipro Music Company. That was very, very beautiful. And that song is a reminder of the care and support that every mother and baby deserve from the very beginning of life. But as we've heard today, this takes more than just an individual effort. It requires the support of families, communities, governments, and partners. This is illustrated well in Papua New Guinea, where significant progress has been made to improve maternal and newborn health, despite persistent challenges. To tell us more, we're honored to be joined live from Port Moresby by the Honorable Minister of Health and HIV and AIDS, Elias Kapavore, and WHO Representative Dr. Seville Husinova. But before we hand over to our colleagues in Papua New Guinea, we'd like to share a short teaser from the It Takes a Village television drama. Produced by WHO and partners with support from the Australian Department of Foreign Affairs and Trade, the series encourages women to seek care early and calls on men in the community in general to play a more active role in maternal health. Let's take a look.
Hello, girls.
Girls, don't tire out Papa. He needs all his energy for training.
What about this one, huh? It looks it's gonna be a boy this time, huh? Sam, I'm open. I think I can score a try.
Last one.
Who's laughing now, huh, kids?
Rex! Rex! Miriam had a baby boy.
A little boy. I'm an auntie again.
Rex will be so happy.
What's wrong?
Bilum Lepikinene is not coming. Miriam needs another woman.
Rex, Miriam is very weak. If the baby's rubbish does not come out soon, she will start bleeding. She needs the health center.
Miriam needs my help. So do we. You'll be fine. Good luck, Rex.
Where's Rex?
I don't think he's playing today, Chief. Miriam's sick.
Rex! Brother, get down!
She's a woman. Take her and a drum. Wake up, wake up.
Please, she's my wife.
Wake up.
Thank you, bro. You're a good man.
Over and out.
What did they say?
He must fly in from Alotao. He'll be here very early in the morning.
Hotel Oscar Romeo, good morning on 124.1.
Miriam needs you. Miriam needs you now. Come quick.
Rex!
It's the doctor. It's the doctor.
Dr. Berry! Dr. Berry!
Everything's changed. But I feel like nothing's changed.
To tell us more, I'm pleased to hand over to Dr. Seville Husinova, WHO representative to Papua New Guinea. Dr. Husinova, over to you.
Good morning, good afternoon, colleagues. I'm very sorry, I got very emotional with this video, which is based on a true story in the realities of Papua New Guinea. But today is a World Health Day, and happy to everyone, World Health Day. It is my great pleasure to introduce Honorable Elias Kapavari, esteemed Minister of Health for Papua New Guinea and Member of Parliament since 2015. Minister Kapavari has previously held the critical positions as the Chief Executive Officer of both the Provincial Health Authority and a provincial hospital, and the Minister of Public Service and Administration. And he demonstrated exemplary leadership as the chairman of the parliamentary committees on health matters, chairman of Public Accounts Committee, and public sector reform. Honorable Minister Kapavari brings a wealth of expertise and experience to the realm of healthcare governance and exemplifies a dedication to enhancing healthcare quality and access. His unwavering passion for implementing comprehensive health reforms, especially and including in the area of comprehensive cancer prevention and treatment services, reflects a resolute commitment to achieving universal health coverage for all citizens of Papua New Guinea as a fundamental obligation to meeting the Papua New Guineans' targets on health and well-being for all and leaving no one behind. Floor is yours, Mr.
Thank you, Dr. Stigall, for this important introduction. I'd like to firstly say happy World Health Day 76th anniversary to the World Health Organization. I commend and I acknowledge the original director for WHO, Dr. Maya Piakala, for your leadership in the region. WHO established the office in PNG in 1975. And as we celebrate our 50th anniversary this year, we want to thank WHO for a long-term partnership with the government of Papua New Guinea. Honorable guests, partners, friends, and families, it is a privilege to be part of this important discussion on World Health Day. Today, I'd like to say how Papua New Guinea is working to improve the health and safety of our mothers and children. That is the reason this mission matters so deeply to us. Here in Papua New Guinea, we are working to turn that hope into reality. We hope that maternal and child health is the foundation of a healthy nation. And while challenges remain, we are making progress, real meaningful progress, through leadership, community partnerships, and strong collaboration with our international and national partners, including the World Health Organization. We know that the reality in Papua New Guinea is still difficult. Every day, 2 women lose their lives to preventable pregnancy-related cases or causes. Only 42% of births happen with skilled health professionals. These are not just numbers, they are lost futures, grieving families, and broken communities, but there's also call for action that we must all participate in. I am proud to say that Papua New Guinea is not just standing still. We are taking bold steps to improve maternal and child health outcomes in partnership with WHO and others. We have a national maternal and newborn health strategy that was developed through a ministerial task force that provides overall guidance to the country's response. This received the seat of approval from the National Executive Council, led by our Prime Minister, who made an important statement that every citizen of our country has or have a fundamental right to quality healthcare wherever they are. That means receiving a healthcare within 1 hour of reach. So that's an important policy statement made by the Prime Minister. A multi-sectoral and multidisciplinary governance structure that stewards the response. The reproductive, maternal, newborn, child, adolescent health technical advisory committee. In response to the call of the regional director on primary healthcare transformation, Papua New Guinea has started the primary healthcare intensification efforts in 4 provinces, exploring various models that will be best fit in our country's context. One model is being designed as an integrated people-centered care across life courses. As part of the patient safety weavers from the recently concluded 7th summit, that is the Patient Safety Summit, I commit to ensure that patient safety principles are embedded in the fabric of health system and continue to be put into action through initiatives in quality of care improvements on antenatal care and in the bathroom and early postpartum care and infection control and prevention. We are working to make every clinic visit count, not just in numbers, but in quality, safety, and compassion. Women deserve respectful and reliable care. With WHO support, we are redressing care to be people-centered, available from the community level in ensuring no woman or child is left behind. Furthermore, we are engaging men at critical patterns too, or as critical partners too, beg your pardon. From this World Health Day, we introduced the tagline, "We men in PNG support, care, and look after our women and children." We are encouraging fathers, brothers, and leaders to step forward as active partners in health. So this is our vision. Our vision is simple, but powerful. As a PNG way, no mother dies giving life, and no child is lost in their first days. Every family has access to a safe and quality care, no matter where they live. This vision requires all of us, not only the health sector, but also education, infrastructures, business, and faith leaders to stand together. Let me close by saying this. We may be an island nation, but we are not isolated in our journey. We are woven to each other, to our region, and the global movement for healthy and dignity for all. We are making a difference, but we still have a lot of work to do. And we welcome and continue to value WHO's support, your partnership, and your belief in a brighter, healthier future for every mother, for every child, and for every family in Papua New Guinea and within our region. And we acknowledge the support also by ADB, DFAT, and UNICEF for also standing together in this important journey. I want to say thank you very much again for allowing us to express and say thank you and participate in your 76th anniversary of the World Health Day. Thank you from Papua New Guinea. Thank you.
Thank you so much, Minister, and over to you, Annie.
Thank you, Minister Kapavore and Dr. Husanova. We will now turn to the Philippines and to learn about the progress, challenges, and considerable efforts underway to improve maternal and newborn health. To help set the scene for this conversation, we have a short video that offers a glimpse into the lived experience of one mother, Dr. Leslie Cedillo. Let's watch Dr. Cedillo's story.
Actually, I had a difficult pregnancy. I'm a new mom. I have a 4-month-old baby. Our firstborn, unfortunately, did not survive. I was only 5 months pregnant at that time. And during this second baby, I still had difficulties with my pregnancy. I had gestational diabetes, and I had complications. I was polyhydramnios. And when our baby was delivered, she was actually premature. I only delivered her at 36 weeks. She was just, I think, 2.3 pounds, and she even went further down to 1.8. The first few weeks was very difficult for us. I'm a medical doctor and a new mom, and thinking that, well, I should know better because I was already knowledgeable about it, but it's different when you're already first-hand experiencing it. It helped our baby a lot, practicing kangaroo mother care. I think in just a span of a few weeks, her weight increased when we practiced kangaroo mother care. And it's not just me who practiced it. My husband also practiced kangaroo mother care. So we were shifting or we were changing roles from time to time. So when I'm tired, my husband would take over and he would also crack kangaroo mother care. And it was a different experience. First, you place the baby in your chest and you have like a cloth covering her. Well, the entire body of the baby should be covered, and then carry her the entire time. Even if you're doing your household chores, the baby needs your heat. You don't need any apparatus or an incubator for the baby to thermoregulate. By being there in your chest, you're already helping your baby. Anyone, meaning mother, father, or even lola, lolo, can actually do KMC. But now, at 4 months, she's already, well, at par with the other kids her age. And she's very active, she's very attentive, and the bonding between me and her is very strong. I think that solidifies my resolve that KMC is really, really very critical and very helpful.
What a beautiful story and such a powerful reminder that quality care, especially in those early moments, can truly save lives. Dr. Leslie Cedillo and her husband, Dr. Daystar Cedillo, are both with us here today. Thank you both for sharing your story. We are so pleased to hear that you and your daughter are doing very well. Thank you again. Now, to take us deeper into this topic, I'm pleased to hand over to Dr. Enyung Ko, Deputy WHO Representative to the Philippines, who will moderate our next segment, a panel discussion featuring esteemed representatives from government, experts, and partners, all working together to improve health outcomes for women and babies in the Philippines. Dr. Ko, over to you.
Thank you, Dr. Annie. Magandang umaga, good morning. It's an honor to welcome you to this panel on maternal and newborn health in the Philippines. The Philippines has been quite successful in advancing maternal care and reducing newborn mortality through innovative programs such as Care for Small Babies, as you just saw from the video. The CSB program focuses on essential newborn care of preterm and low birth weight babies with its core interventions such as kangaroo mother care and support for breastfeeding. In this panel discussion, we share this best practice where mother and baby receive quality care. Today, we are honored to be joined by a distinguished panel, each of whom has dedicated their work to improving the lives of mothers and babies in the country. First, let me introduce Undersecretary Dr. Abdullah Jumama, currently the Department of Health Undersecretary for UHC Health Service Delivery Cluster and concurrent Regional Director of Davao Center for Health Development. Good morning, Dr. Jumama. Next, Dr. Malalai Amazai, Health and Nutrition Chief from our colleague UN agency UNICEF. Good morning. Dr. Socorro Mendoza, neonatologist and founding president of Kangaroo Mother Care Foundation, Philippines, and the lead convener of the Asia Oceania Kangaroo Mother Care Network. Good morning, Dr. Mendoza. Mrs. Patricia Gomez, Executive Director of the Integrated Midwives Association of the Philippines. Good morning, Patricia. Mrs. Hyungwon Lee, Assistant Country Director of the Korea International Cooperation Agency. Good morning, Assistant Director. Thank you for joining us this morning. So each panel members will have around 3 minutes. So my first question goes to Dr. Dumama. Dr. Dumama, you've been a staunch supporter of maternal and child health care in the country. We often hear you quote the phrase like, no mother and women should die of childbirth. So what has been really triggered, inspired you for this cause? And then could you also share a bit of your experience of having worked for maternal and child health care in Davao region? Over to you.
Thank you, Dr. Yun Yung ko. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام عليكم ورحمة الله تعالى وبركاته. Peace be upon you and God bless and mercy upon you. Magandang umaga po sa inyong lahat. Magandang umaga. In 2012, Davao region reported high maternal deaths. No? At that time, I was the regional director, and as was the time, the DOH was closely monitoring our health outcome indicators related to maternal and newborn and child to account our country's accomplishment to MDG. As the regional director then of Davao CHD, I was challenged knowing that only 40% of women receive quality prenatal care in Region 11. And in a short story, in 2013, I had the opportunity to meet the then of former WHO Regional Director, Dr. Shin Young-soo, and his wife when she paid a visit to Davao City for a personal visit. And we discussed about the health situation of Davao region, and he was particularly interested in local actions in responding to malnutrition among under 5 children, and she was particularly interested why is it HIV/AIDS in Davao has risen that much, and he was particularly interested in this local action. So until our conversation deepened when he asked me about the health issues and challenges in the region. So I told Dr. Shin that addressing the health issues under a devolved healthcare is very challenging. So Dr. Chin also shared to me that WHO Western Pacific Region Office has selected the Philippines as one of the countries to demonstrate its subnational initiatives. This means that WHO will provide technical assistance and the journey with the DOH and local partners in developing, testing, or applying and evaluating models or approaches in improving these nagging health issues. This has inspired me actually to invite or request WHO to provide technical assistance in addressing the high maternal mortality in Davao region, especially in one municipality in Davao del Sur, the Malita municipality, because at that time, Malita reported the highest maternal mortality. In fact, the whole province, 20 and 18 of which is concentrated in Malita only. So recognizing the need to address the maternal and the newborn mortality in Davao region, WHO and DOH with funding support, of course, from COICA International Cooperation Agency, launched the subnational initiative called Access, or Accelerating Efforts Through Health System Strengthening for Maternal and Newborn Health, or Access. So in 2015, COICA and WHO entered and provide technical with an agreement with us and provide technical support to Malita. And not only to Malita, but they expanded it to 10 municipalities in Davao region to accelerate improvement of maternal and newborn health through integrated, equity-focused approaches. So the project was jointly conceptualized actually by WHO and Davao region, and their implementation were implemented. Interventions were implemented from 2015 to 2018. So this subnational initiative provided catalytical, technical, and advisory support to DOH Davao region and 10 local government units to accelerate convergence efforts. So the access for maternal and child health did some strategies. They have started improving leadership and governance, improving capacities of the health services available for mothers and babies, and also additionally the The project supported the certification of selected hospitals, SPMC, Davao Regional Medical Center, and private hospitals like San Pedro Hospital and Ribera Hospital as facilities achieving standard of care for small babies. So they were certified, and up until now SPNC has been recognized as the official certifier for care for small babies in the country. So it has another strategy was creating demand of health services through active engagement and capacitating barangay officials and other community leaders, and of course the community health workers and other support groups. So the SNI Phase 1, since it has been scaled up to Caraga and the Western Visayas regions, implemented these strategies that led to a remarkable outcomes of 63% reduction in maternal deaths and 45% reduction in infant deaths. So, I have already mentioned the strategies. Therefore, I am truly grateful to the WHO and COICA for their unwavering commitment to improving maternal and child, and for supporting the promotion of CSB, and of course for encouraging the Department of Health to adopt this strategy at a national level. Ladies and gentlemen, I am proud to say that this is a project or program that COICA and WHO be proud of. And we're still asking for some more support, continued support. Thank you very much.
Thank you, Dr. Dumama. We truly commend and appreciate your plan to further scale up this good evidence-based program to reduce newborn mortality. Now the mic is yours, Dr. Mendoza. You've been working over decades to promote kangaroo Medicare in the countries, to make it a priority of the countries. Could you share a bit of your journey, and then could you also share what benefits you have seen introducing this program and promoting it? Thank you.
Thank you, Dr. Yun Ko. Good morning, everyone, and thank you for this invitation. It's been 25 years since we started Kangaroo Mother Care in the Philippines after we received training in Bogota, Colombia. And we initiated the first Center of Excellence on KMC at Dr. Josefa Bella Memorial Hospital, the Center, National Maternity Center for the Philippines. This was established in 2000, and the Department of Health supported us initially in 2003 to train 7 other hospitals in Metro Manila. By 2005, we recognized the need to create a KMC network of care in the city of Manila. And so in 2005, that was the first network of care in Kangaroo Mother Care within the city of Manila and the Josefa Bella Memorial Hospital. In 2008, we established and registered the Kangaroo Mother Care Foundation after my early retirement from public office. And following the issuance of the DOH Memorandum on Essential Newborn Care, the Kangaroo Mother Care Foundation started bringing kangaroo care outside Manila. And so we adopted a strategy of training trainers, program managers, implementers, teams that will propel the program in each facility in the region and accredit them as centers of excellence for each region of the country. That was our goal beginning 2010. 2013, Typhoon Haiyan came, and it was an opportune time for WHO and the Kangaroo Mother Care Foundation to work together region-wide. So that was a need that was timely, and we saw how Kangaroo Mother Care could save many lives at a time that disaster and devastation of many hospitals in the region occurred. By 2014, WHO and DOH came together and decided and discussed all of this to put together essential newborn care basic newborn resuscitation, and kangaroo mother care in the package of intervention, now called Care for Small Babies. So in 2014, that strategy was nationalized by DOH, and DOH took over the accreditation of centers of excellence for the entire country. At the time, we had 21 centers already established doing kangaroo care and care for small baby. Now, SNI Phase 1 came at a time when Yusek Dumama was still in the region, and Davao region was the first beneficiary of a region-wide, structured, and systematic program implementation. That SNL1 phase resulted in the accreditation of 6 facilities as centers of excellence, meaning 1 center of excellence for each province of the region. So all the provinces within the region had 1 center of excellence for care for small baby. Of course, the pandemic slowed us down, but SNI Phase 2 came in and supported the development of modules on care for small babies. So the online modules became instrumental for SNI Phase 2, and we were able to reach more healthcare workers despite the pandemic. So from 2021 up to the present, those modules are being implemented in collaboration with us, the Kangaroo Foundation, the Centers of Excellence, and most recently, the Philippine Society of Newborn Medicine. Post-SNI project, the society or the professional society has taken up the modular training course. And that strategy still is being used of post-training evaluation, monitoring, accreditation, continues to this date, and that included the Western Visayas and the Caraga regions in the most recent project sites. Of course, we saw the benefits of kangaroo mother care along the way. We saw how survival of newborns, premature and small babies declined dramatically. During the pandemic, of course, everything just was gone. But between 2021 to 2024, recent survey of the CSB centers demonstrated at least a 30% decline on neonatal mortality rate, 2021, post-pandemic, to the present. Furthermore, we have local evidence to show that maternal depression was significantly decreased in this strategy. Breast milk production and breastfeeding rates for small babies are much better, and family relationships are enriched in this process. These benefits continue to this day, and we truly appreciate the partnership and collaboration between DOH, COICA, and of course, WHO. Thank you very much for this opportunity.
Thank you, Dr. Mendoza. It was interesting during the natural disaster Hainan, and then all the electricity was out, so we had to actually resort to the natural methodology to keep the baby warm and take care through kangaroo mother care. That was quite an interesting story. Now the mic is yours, Mrs. Patricia. As a midwife yourself and as the current executive director of Integrated Midwife Associations, could you also describe a bit of your past work to have improved the maternal and newborn care area, and then particularly focusing on some of the challenges that you have experienced and then some suggestions to improve. Over to you.
Yeah, thank you so much for that very kind introduction. Happy founding anniversary to WHO and happy World Health Day to all of us. Yes, in the Philippines, midwives are often the first point of contact for mothers, and our main role on maternal and newborn care is to provide support and guidance throughout the pregnancy, labor, and the postpartum period, ensuring the well-being of both the mother, of course, and the baby, which is, of course, the very core of our practice. Throughout the process, our role is, of course, is to empower and educate mother, promote natural birth when possible, and collaborate with our partners, our obstetrician, as well as our pediatrician, and other health professionals if medical intervention, of course, is needed. Well, as a midwife, there are definitely both the challenges and rewarding moments that comes with our job. Most challenges we deal with, it includes emotional toll in witnessing the difficulties of our clients during pregnancy, labor, and long hours of waiting, and physical demands as we tend to be on call 24/7. And dealing with pregnancy complication, of course, and emergencies, we must ensure the best outcomes, of course, for both the mother and the baby while working under pressure. As for hooray moments, most, if not all midwives will agree with me, saying that our best moments, of course, are manifested in the joy of bringing new life into the world and being steady presence during a pivotal time in people's lives that make overcoming our challenges that we experience truly worthwhile. In my decades of experience being a midwife's leader, bearing that the IMAP or our organization sustained its roles and responsibility as the organization of Filipino midwives for over 50 years. Some of the major challenges we've been working on involve balancing advocacy and policy changes. All this time through leading the charge for policy improvement or ensuring projects and programs, of course, for the midwifery education and profession and maternal health initiatives is also a huge accomplishment. Seeing government of local or regulations aligned more closely with the needs of our midwives in maternal care is always among the major goals and successes, of course, of the organization. IMAP very close collaboration with the WHO began in 2014. This was also mentioned, of course, by Dr. Mendoza. 2 years after I assumed the position of IMAP Executive Director when we promoted EINC and other MCH training and care services, especially as mentioned, of course, during that Haiyan and, of course, also the earthquake in Bohol, which caused tremendous devastation and compromise, of course, maternal and child health. Also in 2016, the WHO and the Department of Health, in partnership, of course, with the Kangaroo Mother Care Foundation, for which I'm also one of the board of trustees of this foundation, collaborated with IMAP in its local chapters nationwide for the promotion of Care for Small Babies initiative, which combined, of course, AINC, Kangaroo Mother Care, and community care for KMC graduates. Midwives, we know that we are crucial in the community care for small babies, especially in far-flung areas of our country. Until now, I'm part of the evaluation team that assess CSB-trained facilities for our monitoring and accreditation. Recently, we visited one of the hospitals in Marawi, together, of course, with Dr. Soki Mendoza. We strongly believe that the care for small babies is strategic in saving both the mother and babies and ensuring good health for them, especially, of course, in far-flung areas of our country. The WHO plays a crucial role in shaping and strengthening the midwifery practices in the Philippines, especially through its support in the areas of training, policy development, health system strengthening, and maternal and newborn care. These efforts have helped shape a system where midwives are equipped with the necessary tools, training, and recognition to provide safe, high quality to mothers and newborns, ultimately contributing to the reduction of maternal and infant mortality in the country. Thank you so much.
Thank you very much. We have still our ways to go, and then despite all the challenges, we'll all unite to continue to endeavor for maternal and child health care. Now we'll move to Dr. Malalay, our endearing colleagues from UNICEF. So my question would be, what do you think the roles of the health partners to improve further maternal and newborn care in this country? Over to you.
Thank you. Good morning. Assalamu alaikum wa rahmatullahi wa barakatuh. So pleased to be here, first of all. Thank you for the invite, and also pleased to meet some old colleagues as well here. And this is my third time in this room. First time I came in 2011 in immunization tag meeting. I was there, at that time I worked in Cambodia. So pleased to come back and have some kind of connection back to this. So first of all, as WHO and UNICEF, we are very thankful to the Department of Health for being open, supportive, listening to us, and seeking our assistance and technical support. This relationship has been very mutual. And this has been evident from the times that we worked together in the past, for example, in COVID-19 response times. It has also been very much evident when it comes to the other emergencies responses. For example, we had recently measles outbreak in BAM, and WHO and UNICEF collectively worked with Department of Health and Ministry of Health, BARM, to respond to it. And this was one of the best responses, with very high number of children vaccinated. We also see that when we work together, there has been very many great results we have ever seen in the past. For example, Philippines is now no more among the top 10 countries with zero-dose children. We feel proud, and we are part of this success story with Department of Health and with our partners. So coming to the partner support in specific, when it comes to WHO and UNICEF partnership, it goes back to the founding years of both agencies. And our mandate has been very complementary. I don't know how many of you might remember GO-B. That was UNICEF team in very early 1940s, growth monitoring, ORS, breastfeeding, and immunization. So we were working on those 4 areas, and of course with WHO and other partners. When it comes to the modality of our support in the Philippines with other partners and donors and bilateral, including bilateral donors, and all, like COICA, for example, we are here to provide technical support. Like, our staff is our commodity. We are the ones to go to the Department of Health to support the regions, provinces, by generating evidences, by supporting policy environments. So the policies are sound, evidence-based, and cater to the need of communities, women, children, and adolescents. And also when it comes to the complementarity, our mandates are quite complementary when it comes to WHO, UNICEF. And to improve and to gain efficiency, we also engage in joint programs. For example, currently we have a joint program with COICA that is on reducing adolescent pregnancies, and WHO, UNICEF, and UNFP are the partnering to support Department of Health and some targeted provinces on this initiative. And it's also about our division of labor. Like, for example, WHO sets the normative, the policy environment supports, and we, for example, as UNICEF, support the supply chain, for example, when it comes to the health system strengthening. So these are the few evidences and example I wanted to give how well we are working together. In Philippines, it has been very great experience with WHO. During COVID-19 response, we usually went to airport together to receive vaccines along with Department of Health. It's just an example how closely we work together. We were together in all the platforms, raising awareness, supporting the policy and implementation platforms. And also when it comes to the emergency response, WHO is the chair of the health cluster and UNICEF is the co-chair of the cluster. So this is also a complementarity that we bring to the table. So it has been, when it comes to maternal and newborn health, there is a saying that if you want to see the system's efficiency, look at the numbers of maternal newborn deaths in a country, because that is where you will see how the system has been efficient. And we know that Philippines is doing great strides to achieve those results. And there are very good practices in the region, provinces where, and you saw them here, that how the Kangro Mother Care has been promoted, how the midwives are working together. And of course, the role of UNICEF and WHO has been essential to set the guidelines, standards, support capacity building, demand generation for services, and also looking at the public finances for children as well. So thank you very much.
Thank you very much, Malalai. With the good partnership and collaboration, we only have gaps, no more duplication. And I also appreciate some of the UN colleagues at the agency who also support big time for the health sector under the leadership of Department of Health. Now, our last, not the least, panel member, Country Director of COICA, Mrs. Lee, could I invite you for some comments, particularly in relation to the COICA supported project to improve maternal and child health care? Thank you.
Thank you. Good morning. 안녕하세요. It's great honor and happy to have a chance to talk about the importance of maternal and child health. COICA Philippines has long prioritized maternal and child health with the partnership of Philippine government. Appreciate the unwavering collaboration. Thank you, Secretary Herbosa and Yusek Mama. We currently support 7 multi-year projects on reproductive, maternal, newborn, child, and adolescent health, especially in Visayas and Mindanao. These include projects with WHO, as Yusek Dumama explained, like Subnational Initiative Phase 1 and currently Phase 2, which works to strengthen Rumenca services in Aklan, Agusan del Sur, and Davao region. Through this project, COICA support has led to more women receiving prenatal care, more babies born in safe facilities, and higher breastfeeding rates. By improving local health systems and equipping facilities, we've helped to reduce maternal and infant deaths. A key highlight is the Care for Small Babies program. Together with WHO and local governments, COICA helped establish the Centers of Excellence in Care for Small Babies. We provided neonatal equipment and training, while local government renovated hospital facilities. This joint investment improves survival for premature and low birth weight babies and strengthens long-term health system capacity. Also, we are proud to support tools like the Performance Accountability System PASS, which help local government improve planning, decision-making, and tracking of health services. This partnership between Korea and Philippines goes beyond development. As we work side by side, we build trust. We continue our lasting friendship by investing in health and also the future generations. Thank you.
Thank you very much. Now I have distinct honor to invite our Secretary of Health from the Department of Health of the Philippines, Dr. Herbosa, for closing remark for this panel session. Thank you.
Thank you very much, Dr. Yung Yong Ko. And let me acknowledge our WHO Regional Director for the Western Pacific, Dr. Saiya Mao Pukala, my friend. Our WHO representatives that were in the call earlier, Dr. Seville Hussein Nova, Country Representative for Papua New Guinea. Of course, Dr. Yun Yong Ko, Deputy Country Representative of WHO in the Philippines. Members of the Diplomatic Corps, I see several of my ambassador colleagues here from the member states of the Western Pacific Regional Office. Undersecretary Abdullah Dumama Jr., Undersecretary of the Department of Health. Partners from the Asia Oceania Kangaroo Mother Care Network, from the Integrated Midwives Association of the Philippines, from UNICEF Philippines, Malalay, ever since COICA, of course. Esteemed guests, friends, magandang umaga po, a pleasant morning to all. Of course, happy World Health Day and happy birthday to WHO. Today is the birthday of WHO as well. Allow me to express my deepest gratitude to the World Health Organization, especially the Western Pacific Regional Office, led by Dr. Saiya Mao Pukala, for organizing this meaningful gathering and for the strong partnership in advancing maternal and newborn health across our region. Let me also extend my appreciation for the valuable support in the recently concluded 7th Global Ministerial Summit on Patient Safety. And I say there can be no good maternal and child care if there is no patient safety. These continuous collaborations are vital in helping us build a stronger, safer, and more equitable global health system. But allow me to bring you back in time a document I was reading this morning was a document of the International Health Conference in New York, dated 19 June to 22 July 1946. And there were the minutes of that meeting, concluding meeting, and I would quote the statement of Dr. Hilario Lara. Dr. Hilario Lara is the father of modern public health in the Philippines. We have a building named after him, where our Director of Program Management studied her master's in public health. Dr. Hilario Lara stated, and I quote what he stated in the meeting, the Philippines unanimously accepts the report of the Technical Preparatory Committee on the working basis for the conference, and in congratulating the members of the committee in this splendid achievement. This is the birth, this is the maternal history of the WHO. The conference must face these subsequent problems to do and solve in the first of all in health. And if the people of the world were to live together and be behind these principles laid down by the committee, would provide good guidance. He assured that with the utmost cooperation of the Philippines, his country, and convey to everyone the good wishes of the people. And with that, July 22, 1946, 61 countries signed the WHO Constitution. The Philippines was one of them. And on April 7, 1948, WHO started officially operating. So it's just a bit of history for why we're here all today. So today's celebration is not just the well-being of mothers and their newborn, that is essential for survival, but fundamental to shaping healthier communities. While we acknowledge the progress made, particularly here in the Western Pacific, there is still much to be done. Across the globe, women and children continue to suffer and lose their lives to complications related to pregnancy and childbirth. These tragedies, often silent and preventable, are rooted in inequities and the limited access to quality care, particularly in resource-constrained settings. In the Philippines, we have embraced this challenge and a deep sense of responsibility. In alignment with our 8-point action agenda, the Department of Health has made maternal and newborn health a central priority. Under my leadership, we have also elevated women's health as a key pillar of all our efforts. One of three, disease prevention, acute care, and women's health. We are committed to ensuring that every mother receives compassionate, respectful, and life-saving care throughout every stage of pregnancy, childbirth, and even in the postpartum period. Thus, we are committed to reducing our maternal deaths in this country by the following. We are strengthening our health system to ensure that antenatal checkups, safe deliveries, and postnatal support are not only offered but truly accessible, even our most remote and underserved communities. Let me also state that I partnered with one of the largest malls to put up an adolescent clinic, because our biggest problem is adolescent unplanned pregnancies leading to a high maternal mortality. This is where our children actually go on weekends, so making services offered to these young girls. We are also expanding the capacity of our health workforce by providing training for midwives and barangay health workers, our community health teams, who are in the front line of care in our most remote areas, while also enhancing the skills of healthcare professionals across all levels of care. We are also enhancing partnerships with both international and local development partners who will help strengthen our efforts and resources, improving health and well-being of women and children. By the way, we have lost a big amount of money on our support, financial support in reproductive health, and I do hope my colleagues here in the diplomatic corps will be ready to fill in the gap that has been left. Through the Purok Kalusugan initiative and the Bukas initiative, we are grounding health reform in the smallest units of community life in the Philippines. The Purok is smaller than the barangay, And while this is an informal organization, the Purok represents a very powerful front line for outreach, implementation, and meaningful engagement, really concretizing the concept of social determinants for healthcare. Here, in the Purok, maternal care becomes not just a program, but a community responsibility. It is shared, sustained, and strengthened by grassroots leadership, the Purok leader. Today's discussion has been an important space for sharing best practices and identifying pathways forward. We are both inspired and encouraged by the stories from our own communities, the powerful reminders that maternal and child care must be anchored in respect, guided by cultural sensitivity, and upheld by a commitment to human dignity. We extend our heartfelt thanks to the panelists for their insightful and enriching exchange. And as we close this celebration, let us carry forward a clear message that the journey to a healthier world begins with ensuring that every mother is seen, heard, and cared for, and every newborn is welcomed into life with safety and hope. This journey is not one we walk alone. It demands our continued global cooperation, bold leadership, and underlying compassion. So let us unite in steadfast commitment to cherish and uplift our mothers and shield the hopes and dreams of our children, for in their hands lies the boundless promise of tomorrow. May our efforts in the Western Pacific continue to bring life, dignity, safety, and opportunity to every family. Mabuhay, maraming salamat po.
Thank you, Secretary, for your very clear message and then commitment and leadership to improve maternal and child health care. Now, over to you, Dr. Ani.
Thank you, Secretary Herbosa, Dr. Ko, and to all of our panelists for sharing your experiences with us, the excellent work and partnerships in improving maternal and newborn health in the Philippines. And now we're also honored to hear from someone who brings a personal perspective to this issue, an advocate, a mother, a passionate voice for women's issues. She'll reflect on her own experiences of pregnancy and childbirth and what she's seen and heard from women across the Philippines. Please join me in welcoming TV host, writer, advocate, and UN Women volunteer, Ms. Bianca Gonzalez Intal. Ms. Bianca, the floor is yours.
Thank you very much. Good morning, everyone, to our esteemed guests from the government, diplomatic corps, to our partners, and of course, our WHO colleagues. I'm so inspired by everything I heard, all the work that you do. I wish that everything you said would be amplified more in the media so more people will know about this incredible work and the incredible plans. My name is Bianca Gonzalez. It's an absolute honor to join you today. I'm a Filipina TV host. I'm a UN Women volunteer, but of course, my most important role is being a wife and a mother. If our two daughters in the photo that I am about to show you look healthy and happy, thankfully they are, but rewind to the year 2018, I actually was not so sure about how hopeful I could be for me and my child's future. Unlike my first pregnancy and delivery that was pretty smooth sailing, my second pregnancy was difficult and draining. This is what I looked like for the first 2 trimesters of carrying our second child. I had hyperemesis gravidarium. It was all day, all night sickness. I would vomit 8 to 10 times every single day. I lost 9 pounds in the first 2 weeks. I still had to go to work, and none of my colleagues knew that every time I had a bathroom break, it would be to vomit. And I was very worried that if I wasn't a healthy mother, my baby may not be getting the nutrients that she needs. Because I suffered in silence, being a public personality, I was judged, I was mocked, I was called anorexic for being too thin. That's the point where I decided to put my foot down, to call out people who dangerously and loosely use these terms, and most importantly, to share my story to other mothers who might be experiencing the same thing, to make them feel that they were not alone. Thankfully, with the guidance and care of my OB gynecologist, I was able to carry my daughter to full term and gave birth to her at 39 weeks. But apparently, our challenges did not stop there. Our doctors found our daughter had some sort of liquid in her lungs, something they suspect happened while I was delivering the baby. Of course, our heart sank. Was our daughter going to be okay? And was it my fault? What went wrong? We had to stay another week in the hospital as they observed and treated our daughter in the NICU, or the Neonatal Intensive Care Unit. My husband and our firstborn could only see the baby through the glass in the nursery, and it was really painful and scary that we could not bring her home. Any mother can tell you the journey of pregnancy, labor, delivery is a roller coaster, not just of emotions, but of hormones as well. And having to add the weight of physical and mental health is overwhelming. Yet again, thankfully, with the support and care of our pediatrician and specialists, by the end of the week, the infection was treated. We are finally able to bring home our daughter healthy and well. What me and my then newborn went through is something I definitely would not wish on any other mother and child. But despite this, I consider myself to be incredibly lucky because my daughter and I had access and resources to get proper health care and support. But our story, of course, is the exception and unfortunately not the norm. So many other mothers around the country and the region, as we've heard today, do not get access to the quality healthcare and support that is crucial for all mothers. In Bonggao, Tawi-Tawi, the southernmost tip of the country, where I recently did a field mission with UN Women Philippines, I got to meet Araceli, who has her back turned in the picture, and Delwina. They are both mothers and both healthcare workers in their barangay. They shared that a lot of women choose to give birth in their own homes despite the risk to both the mother's and baby's life, sometimes because they live too far away from the barangay health center, or sometimes even if they live just a minute's walk away, they would choose traditional practices because of the lack of awareness of the proper care that they need. There was such a feeling of helplessness listening to all their stories. Why could I get the access to the care that I need and they have limited to none? Is this really our reality, and what can we do about it? To be honest, I have no answers, which is why I'm here today to listen to you all. But I know I am here today because I am committed to raising awareness for this important issue. As a mother, I believe mothers deserve better than just surviving pregnancy and childbirth. Mothers deserve quality care because our health and our children's health is the foundation of healthy families, therefore healthy communities and healthy nations. To end, I'd like to highlight one important point. All of us in this room, we're all very different. We all have different backgrounds, but we all share one thing in common. We all have a mother, right? And without them, we won't be here today, which is why this issue is critically important. For every mother to have a positive and safe pregnancy, childbirth, and postnatal care. As Secretary Bosa said earlier, and I'll translate it into Tagalog, malayo na pero malayo pa. There's still much to be done. I believe that each of us here now has the collective power to make lasting change. So game, let's do it. Thank you very much and happy World Health Day to everyone.
Thank you, Bianca, for sharing your powerful story and for reminding us why this work truly matters. As we near the close of today's celebration, we invite you all to take part in a symbolic gesture, one that brings together the ideas, the inspiration, the commitment we've heard throughout this morning. In his address, our regional director reminded us that providing maternal and newborn health is like weaving a mat, where each strand represents the vital contributions of all of us. Now, we ask for you to finalize your personal action or commitment on the blue card in front of you. And now on the screen, we will also share some examples of the commitment and actions. Thank you. Once you're ready, and if you feel comfortable to do so, please make your way to the front of the room and place your card on the woven board to my left. An expression of our shared efforts to support women and newborns across the region. And as we do this, please enjoy a final performance by, once again, our very own WHO Wipro Music Company. Thank you.
Stop your crying, it'll be alright. Just take my hand, hold it together.
Thank you, everyone. We'd like to invite you to please take your seat. Thank you, everyone.
Nice to meet you. Nice to meet you.
Thank you, everyone. If we could ask for you to please take your seat.
I have your things and this one. You need it.
Excellencies.
Should we wait?
Okay, thank you everyone for contributing to weaving the mat. Excellencies, distinguished guests, and colleagues, thank you for adding your own strands of action to our collective mat of support. Your commitment today are a reminder that change begins with each of us. For those who did not get a chance to attach your card, the board will move to the foyer on your way out. And that brings us to the end of today's World Health Day celebration. On behalf of WHO, thank you for being with us this morning, whether here in the room or tuning in online. Today we've heard voices from across the region, leaders, experts, advocates, and communities, all united by a shared commitment to ensure that every woman and every newborn not only survives, but thrives. We are reminded that maternal and newborn health is not just a health issue, it is a human right, a foundation for stronger families, healthier societies, and a brighter future for all. Let us carry forward the spirit of today. Let us weave together our efforts, governments, health workers, partners, and communities to build systems that listen, care, and respond to the needs of every woman and every baby. To everyone online, thank you again for joining us. And to those in the room, we invite you now to gather for a quick group photo. In a moment, I will ask that everyone on the lower level of the conference hall to please stand and make your way to the center of the horseshoe. With that, thank you once again for being a part of this meaningful day. It's been my absolute pleasure to guide you through today's program. Happy World Health Day again, and here's to healthy beginnings and hopeful futures for all. Thank you.